Hi, I'm Dr. Shu from Animal Medical Hospital here in Pasadena. I want you to think about how often you brush your teeth at home and how often you brush your pet's teeth at home. The most common thing that you're gonna see when you are looking at your dog's teeth is probably tartar and also the odor. Pet odor stems from gingivitis, which is essentially inflammation of the gums from the bacteria that sit along their gum line. Can you sit? When we're evaluating their teeth, you wanna take a look at their teeth, see if there's any bleeding of the gums, and also notice you've got a little bit of tartar. Tartar tends to build up on these particular teeth because these are what we call the carnassial teeth, where this is where they're biting on most of their treats and most of their food. It is something that we advise working with them at a very young age so they're comfortable with you in their mouth. When we brush our pet's teeth, we like to use specific toothpaste. Most importantly, please use a veterinary brand toothpaste. Using any human-based toothpaste is very dangerous for your pet because it contains fluoride. And if you know, our pets don't usually spit out the toothpaste when we're done brushing their teeth. We personally like CET enzymatic brand. They come with different flavors, and this little guy is pretty easy going with the toothpaste. When you're working with your pet for the very first time brushing their teeth, you wanna go ahead and put a very small amount on your finger and offer it like a treat. If they're comfortable taking it as a treat, go ahead and put it on your finger and start rubbing it on their gum line. Once they're comfortable with you rubbing it on their gum line, go ahead and put it on a toothbrush. Typically, just like at home, ideally 30 seconds per each quadrant. We know that can be quite challenging. So as long as you get the toothpaste directed onto their teeth with some vibration, at least 10 seconds each quadrant is advised. Get all the way in the back. Now, if you notice, he still has that tartar on his teeth and he's got a little bit of bleeding. So he has some gingivitis there. The tartar will need to be removed when he has his next dental cleaning. Typically, tartar can be removed two ways, non-anesthetic dental cleaning and anesthetic dental cleaning. Once you're done brushing their teeth, you should be doing this, ideally, I'll tell you, every day. Just like humans, we brush our teeth every day. But I'm an owner too, and I know that can be difficult. So if you can do it at least 3 times a week, we'll take that as a win. The other thing that you can do for your pet when dealing with dental care is certain diets. There are certain dental diets that help break down the tartar, and the mechanical breakdown of chewing on the tartar does help it break down. Hill's TD is one of the diets we recommend. Another recommendation we have is Oravet. Oravet is one of the treats that is made to basically help break down plaque. What you can see with Oravet, it has a line in the middle. Oravet's a little bit different than your typical other oral treats. The reason we like this is that line is actually something called delmopanol, which is something taken from human dentistry. Delmopanol mixes with saliva to help break down plaque. The most important thing is as you're giving them this treat, make sure they're chewing on each side at least 15 seconds before giving them the entire treat. If your pet is not a good chewer and they just chew and then swallow, this is probably not the treat for you. For my pet, I like to hold it in their mouth, which forces them to eat it a little bit slower and then release that delmopanol in their teeth. So after taking care of your dog's teeth and giving the Oravet, the best thing that you can do to make sure you've done a good job is the smell test. Let me smell your breath. Minty fresh. So make sure to look at your dog's teeth. This is just as important as how your annual visit with your doctor, blood draws. Taking care of their teeth is another vital organ and vital for their long-term health. If you have any questions, give us a call, let us know. Stop on by.